Slowly. Slowly.
Okay.
slowly.
But I can only do it slowly.
Okay. Hold me. Hold my shoulder. Hold my shoulder.
19 years ago, Richard Ashworth left behind a successful career as an office manager to take care of his adopted father.
Okay, come, John. Come.
You back.
Come this way. Have your breakfast.
Richard's father, John, suffers from many age-related health issues, including dementia. John is 83 years old, and these conditions have left his elderly life in tatters.
Oh, God.
John's dementia has also taken its toll on Richard's mental health.
Oh, I'm dead. I'm frozen.
Richard might not know it, but experts describe what he's experiencing as a sign of a phenomenon called caregiver burnout. It is a state of mental and physical exhaustion caused by prolonged stress of caregiving. Beyond our professional carers, it's estimated there are over 210,000 full-time caregivers in Singapore, and 6 in 10 are above 40 years of age. In this episode, I want to discover exactly what caregiver burnout is and what can be done to combat its devastating effects. Like Richard, anyone caring for their frail or disabled loved ones will experience stress and fatigue. But what pushes them to a state of caregiver burnout? So, Richard, could you describe the abrupt shift when your father had dementia?
I gave up my job 19 years ago because my father suffered from colon cancer. And 5 years ago, he suffered from dementia. You see, financially, still manageable, right? But at the end of the day, I will have a zero balance because I don't have a job.
Can you describe to me how you feel every day being the main caregiver?
During those days, how to handle him at home when he starts screaming and shouting and start arguing with you, and you just don't know how to handle him. Yeah, I'm an inexperienced caregiver. I get so angry, I get so frustrated. How to actually handle him? When he starts screaming and shouting, I will start arguing with him also. Why you doing this to me? Why all these things? That was a really hard journey for me in the beginning.
So what happens when we experience burnout? Our brain gets flooded with a stress hormone called cortisol. This affects the prefrontal cortex and impairs judgment and cognitive abilities. When mental exhaustion sets in, it can lead to drastic changes in behavior, and in some cases, it can even make you turn against the person you love. The pressures that caregivers like Richard face are not isolated cases. 2 years ago, 70-year-old Tang So-ha killed his disabled daughter and then himself. After 27 years of caregiving, he was no longer able to deal with the stresses of it. I want to know how many caregivers report feeling burnt out, so I'm reaching out to some of Singapore's biggest care agencies. I'm really curious to find out how many caregivers call, maybe on a weekly basis, calling you saying that they can't cope anymore.
I'm not sure whether we can pull out numbers on how many people call in to ask for support because they feel stressed.
There are not many figures about it at the moment, so I don't have the number.
We don't have any particular statistic on caregiver burnout.
After calling 6 major caregiver agencies, it became clear to me that there are no official statistics on the number of burnout cases. So I reached out to Manmohan Singh. He's a former director of the Asian Women's Welfare Association, which is a non-governmental organization specializing in providing support for those with disability in their family. Manmohan is no stranger to caregiving. He left his job 2 years ago to take care of his elderly mother. So Mohan, there are no official statistics nationally on the number of people suffering from caregiver burnout. Why is that?
There may not be a specific study on caregiver burnout per se, at the macro level, at the national level. However, we know that there are studies that focus more narrowly, but the main thing is that the patient is normally seen as the primary focus of all studies. So the caregiver is secondary.
Then how do we know how big a problem is caregiver burnout?
Well, it can be a big problem if the caregiver feels that there is no support.
Who is more prone then to suffering from burnout?
The fact that majority of caregivers are women, in that sense you will see more of them being prone to it. But I think some women have better coping skills than men. But I would say that it's a combination of factors. It is the caregivers' coping skills themselves, how long the duration of the caring episode is. I would say without having done a detailed study, it might be very hard to draw those kind of conclusions.
How can we then tell the difference between stress, regular stress, and caregiver burnout?
Burnout, you're exhausted emotionally, physically, and feeling quite drained, and also probably feeling a lot of emotional turmoil about the condition of our loved one, or even our own aspirations, because our career was put on hold and financial constraints and what have you. So it's all coming together, that might lead to severe depression and, of course, the possibility of burnout.
Caregiver burnout symptoms overlap with other stress-related disorders like anxiety, depression, and physical exhaustion. It's clear burnout needs much more attention because lives are at stake.
I'm exploring the symptoms of caregiver burnout, and I've learned that it might not be so easy to detect symptoms because they overlap with other stress-related disorders such as anxiety, depression, and physical exhaustion. I'm meeting Richard again. Today he's taking his dad to the Alzheimer's Disease Association, a voluntary welfare organization which supports caregivers and their loved ones with dementia.
As a result of your caregiving duties, do you have a social life?
My father's situation is stable, will not have the kind of bad temper and things like that. My friend called me, I said I will join them, but chances very rare.
This is the first time Richard is seeing a social worker at the Alzheimer's Disease Association. He decided to seek help because he is increasingly unable to cope with his father's tantrums. The last straw came one morning after a prolonged shouting match between father and son, leaving Richard drained physically and emotionally.
Okay. You are done.
Because I'm alone at home with him. The moment he starts screaming and shouting,
you have to
you
attend.
cannot just I can't be bothered. So the moment of time, you just what can I do?
Yeah.
What can I do? But the frustration that you have in that moment is really terrible. Really terrible.
What about live-in help? Would that be an option for Richard?
Usually in Singapore, most of us, we will actually get a female domestic worker to come in to help.
I mean, with my father's size, 6'2" and almost 100 kg, I'm only 5'2". I have to handle him. I think it's a very difficult task, even for actually female domestic helper itself.
I think the possibility of exploring a male helper and the possibility of 2 male helpers, because it allows you to kind of plan who to take maybe the morning shift, the afternoon shift, the night shift, so that it also allows caregiving respite for them and for yourself.
Do you think it's workable?
Yeah, I think let's try.
Why
What
not
do you
have a
think?
try? Yes. I think we should have a try.
Richard is convinced that hiring male domestic workers will be a viable solution, but male domestic workers are rare. The Alzheimer's Disease Association will help Richard make an appeal with the Manpower Ministry. But the cost of hiring one male domestic worker will set Richard back about $500 a month. He plans to dip into his savings and use John's pension money to pay for the extra help. Richard left his job to take care of his father. But there are about 100,000 caregivers in Singapore who are still working full-time. They have to juggle both work and caregiving responsibilities. One such working caregiver is 41-year-old Mun Fai. He juggles employment as a mechanical engineer with being the sole caregiver to his wife. Mun Fai could only meet me late at night. It's the only time he could spare in between taking care of his wife and 3 children. His role as primary caregiver to his wife, Bibi, was thrust upon him 4 years ago.
Hi, how you doing?
Okay. She was 8 months pregnant. It happens very suddenly that she developed this high blood pressure, followed by pneumonia, and then fits, and the last one was a heart attack. So that night in the operating theatre, there's 2 doctors. One was doing the CPR, and one doctor was doing the emergency cesarean to remove the baby. So because she cannot breathe, it will affect the baby. We did an MRI. It shows the vision was affected, the motor skills affected, and the speech is affected.
With 3 young children and a wife to take care of, the pressure of caregiving has been immense for Mun Fai. And beyond his emotional burdens, Mun Fai has experienced growing financial issues.
Speech therapies is about $100 per section. And then
How many sessions do you have?
I have just once a week for speech therapies, followed by physiotherapies, which is $120 per section, once a week. And then aquatic therapies is $250 per section, also once a week.
How has your career taken a toll?
My job is also very dangerous because I deal with machines, and these are live machines I'm dealing with, and a lack of concentration will cause accidents. Baby's condition is unpredictable. She may wake up in the morning feeling uncomfortable, feeling sick, so I have to attend to her.
Do you feel like you may have experienced a burnout in any way?
I actually don't know what to do in the beginning. I really don't know what to do. I don't know what to move forward to. I don't know where to ask for help.
Like Richard, Mun Fai never sought professional help to cope with all these pressures. But unlike Richard, Mun Fai believes he has yet to reach breaking point. But I know he needs urgent help. I've arranged for Mun Fai to meet clinical psychologist Annabelle Chow. Over the past 9 years, she's been helping caregivers deal with burnout. So Dr. Annabelle Chow and Mun Fai are in this room behind me right now having a psychotherapy session to get to know each other better, to build rapport with each other before they proceed for counselling. So I trust that both of you had a good private psychotherapy session just now?
Yes,
Yeah?
very good.
Very good. I'm very glad to hear that. Without revealing too much personal information, would you give us an assessment of where Mun Fai is at or what he might be dealing with?
I would say that he is definitely burnout. And, one of those things about burnout is that, the feelings of numbness and the kind of feelings of being disconnected with what you're doing or your everyday life and feeling very inefficient or feeling very ineffective. So I would say that this is not just normal stress or everyday exhaustion, it is burnout.
Having that confirmation from a professional, how's that make you feel?
It makes me feel much clearer about myself, and then some solution to try out to break away from this burnout.
On that note, do you think that therapy sessions are important for people like Mun Fai?
I think definitely in your situation, I would highly recommend psychotherapy ongoing. If you don't look after yourself well, you can't look after other people.
Mun Fai found the session useful, but I wonder if he will come for the next one. That would set him back $200 to $330 a visit. It's an additional cost he can ill afford. If psychotherapy sessions aren't viable, there might be another way to help our caregivers. It's known as Respite Care. This is when a professional worker steps in to provide relief to caregivers for a short period of time so that they can focus on themselves.
Caregivers will also get some respite. They will be helped by services that care for seniors with dementia.
Respite care can be broadly divided into two categories: home care or center-based services. Of the two, the center-based services are the cheaper option. For the past 16 years, Fadila has been taking care of her son Saifullah, who has cerebral palsy. Saifullah's immobility and speech difficulties have led him to be completely dependent on his mother.
So taking care of Saifullah is like a full-time job.
Yes.
When was the last time you did anything for yourself, like watch a movie by yourself?
Very, very long time ago.
Like how long? Are we talking about years?
Years. That was about, he's 16 then, I guess it is, 16 years.
Gosh, 16 years.
16 years old.
Other than taking care of Saifullah, who is the eldest in the family, Fadila looks after her two younger children single-handedly.
Would you consider respite care?
Yes, I might consider it. If just to have a me time by myself, why not? Is it okay for me to get the me time again? Because the sense of being left by someone to take care other than mommy. So I don't know how he's going to accept that.
As a single parent with no income, Fadila qualifies for subsidies which cover 80% of respite care service costs. But that means she would still need to fork out more than $100 a month for the service. So how viable is this option for our caregivers? When a loved one becomes a patient at home, it can quickly take a toll on the family, especially on the primary caregiver. For a price, respite care services can help caregivers by allowing them to take a break from their duties. There are a total of 12 daycare centers and 40 nursing homes providing respite care services across the island. As of February this year, over 2,400 caregivers have tapped onto respite care in Singapore. That's only 10% of our caregivers. Why aren't they turning to respite services? When I met 41-year-old Siti Fadila, she told me she has not had a break for 16 years because of her caregiving responsibilities towards her son. She also found it extremely difficult to leave Saifullah, who suffers from separation anxiety when his mother is not around him. I'm hoping to change that. So I'm bringing her to a special event this weekend.
I'm here today with Madam Fadila at a World Health Day community event. It brings together several caregiving agencies and experts from Singapore. Its aim is to focus on the issues surrounding caregiving.
Caregiving, although it's a lonely journey, but you are not alone. There is a lot of resources up there to help you, to support you.
One of the announcements today is about a new pilot program called Go Respite. It aims to shorten the application process for respite care from 4 weeks to 7 days. From April, caregivers can register in advance for respite care at selected nursing homes and elder care centres.
If, let's say, you need a few hours of me time, our caregiver can actually do the normal duties that you require, maybe bathing, feeding him.
And is this subsidized or what are your...
At the moment, it's not. And basically the hourly rates goes from $18 to $25. It depends on how care you need and also the experience of our caregivers.
So did you find today's event useful?
Definitely. I was surprised today when I visit one of the booths. They have this home respite care where they come to the home to look and assess the clients. The only setback that I have now is due to financial constraint, and also they don't have subsidy. So that is where, as a caregiver, when we are looking for certain services, we definitely want it to be heavily subsidized.
Centre-based respite care services can cost up to $3,500 a month. Low-income households, like Fadila's, can receive up to 80% in subsidies. But this is applicable only for selected services. Caregivers with a per capita household income of more than $2,600 don't qualify for subsidies at all. So, for many, hiring a foreign domestic worker seems to be a cheaper option than respite services. While Madam Fadila explores the other services available, Manfai turns up at the event with his wife Bibi. He's also looking for support services that can help him.
What we do is actually we help to take care of your loved ones in the center during the day.
If Manfai enrolls his wife into a respite center near his home, he'll be eligible for subsidies as high as 40%. The cost? $47 a day after subsidies.
So, how come you didn't know about all these subsidies before?
I'm not exposed to any other things.
Right.
So I'm basically trapped in this confined area. I didn't know that there's so much available outside.
So how does that make you feel now?
Actually, it makes me feel less burdened, and I feel there's hope coming.
Back at Richard's, there is finally some good news. After 1 year, his request for male domestic helpers was finally approved.
So Richard, tell me, why was the process so long to engage male domestic help?
When I first time saw the newspaper headline front page, there's a male domestic helper available. This is why I approach the maid agency. Then we start from there for application. By default, MOM for domestic helper had to be female. So, but again, like after the process being rejected, then I approached ADA, helped me to appeal on my behalf. And then it took a while, but eventually it was approved.
What has life been like with male domestic help?
Physically, a lot of things is a relief for me. When the male helper take him to shower, so I can actually in the room have a quiet time for probably half an hour to 1 hour.
While the two helpers give Richard the much-needed respite from his caregiving duties, it comes at a cost. Richard has to fork out close to $1,200 every month on his domestic helpers, a cost he feels he cannot do without.
So guys,
in this room, yeah, Bibi's like, yes, please. Caregiver burnout is an issue that many continue to face. And as Singapore's population gets older, it's something that more of us will experience in the future. It's clear to me that our society is slowly starting to acknowledge this issue.
But the key thing I've learned is to prevent burnout before it happens, which will ultimately improve the lives of both the caregivers and their loved ones.